Good evening, everyone. This is Dan Limmer, one of the Limmers and Limmer Creative. I'd like to welcome you to our office hours. It's December 5th, and people tend to wander in a little bit late. I'm going to give a little bit of introduction and explain what's going to happen tonight as people continue to come into the online session. My name is Dan Limmer, one of the founders of Limmer Creative. I had the good fortune to be in EMS. This is my 40th year. I'm a paramedic, also work in law enforcement. I've had the good fortune to write EMS textbooks. If you're using the yellow emergency care EMT textbook in your class right now, that would be, you'll see my name on the cover of that, I'm very happy to say. And we formed this company, Limmer Creative, to do exam preparation, it could be your state test, but now most people are going to the NREMT. So we're going to demonstrate what we do in office hours. We've invited everybody along. I do these every week. Anyone that subscribes to our emtreview.com site is able to come into these office hours and we study together. I'm expecting well over 100 people tonight, so I can't unmute people and have a conversation, sadly. On the right-hand side of your screen, there is a box that says questions. At least my control panel's on the right-hand side of the screen. There's a thing you'll see there for questions, and feel free to type questions in. I'll look at those on my screen here. I'll stop and answer what I can. I enjoy communicating with people. I love to have you send me some messages while we do this. So it's very important to do that. So the typical office hours that we have every week generally involves going over some National Registry style questions, and then we do some study. We answer some questions, and we go over a particular part of teaching. Now, emtreview.com, there's also paramedicreview.com. That is a website. And when I built that website, I wanted to do three things. I wanted to make sure people had the right knowledge, and we have the means to give you that knowledge. We work really hard to help you understand National Registry questions. And, people don't put a lot of faith in this, but I want you to have mojo too. I want you to be able to go into the test believing you know what you know, believing that you can go in and pass the National Registry. I think there's a lot of people that go in, they hold back. They don't quite have that confidence or that mojo. So this site is designed to do all those things. I have people come in before they take the registry. I've had people come in on their 6th attempt at the registry, and we've gotten them through. So that's the plan for what we're doing here. So I'd like to start, as we often do, by going over some National Registry style questions. I'm just going to change my screen up here a little bit, and I will be right back. All right, and here we go. Now, let me get my questions up here so we can make sure we look at the questions that people have. I don't see any questions popping up here yet, but feel free to say hello. I know that I have a lot of individuals here, but I also have people projecting this and putting this up for their classes. So I see a lot of familiar instructors here, John and Bill, Andy, Denise. I see a lot of people at either educators or are projecting into the class. The list is getting long, so I'm thrilled that you're all here. So these questions are at the EMT level. These particular questions were written by Bill Brown, the former executive director of the National Registry. I think they're really great registry-style questions, and I'm going to go through these questions. I chose these 5 because I think that they're challenging. I think they really represent the National Registry-style question and the kind of reading that you have to do for these. So here's question number 1 on your screen. I hope that you all are up there and you can see it. Again, feel free to send me a message on the questions section of your program. All right, question number 1. The major complication the body experiences during widespread anaerobic metabolism is the Why doesn't somebody just type a few answers in there? Go to that question part, and we can call those A, B, C, or D. Accumulation of acid, failure to produce ADP, decrease in blood sugar, or development of hypoxia. One of the things the National Registry does at all levels of exams is they take all of the choices and they make them choosable. There's something about them that you will like, something about them that may sound familiar, but you will be required to pick the best answer from what's given. One of the reasons I put this question up here is because it's really, really important to know pathophysiology. It's very, very important, to do that. All right, I need somebody to show me that you're out there, and so I'm not talking to myself. You go over to that questions and type something to me. Either say hello or give me what you think the answer is here. I think I can answer the question. I better be able to if I write an EMT book, huh? What happens here is a lot of people doing questions. Let me see if we're working here. A lot of people doing questions, but I'm not getting them. They're not showing up on my screen here. Hang on. I think I've got a little glitch in the system here. I'm going to continue to work on this and see if I can get that to show, because I can see that there's some people typing. I'm not seeing them. Well, let's go over the question. Anaerobic metabolism. Anaerobic metabolism means without oxygen. And if we look at the way the body processes and builds energy, if we have oxygen, we have aerobic metabolism. Without it, things go bad. Essentially, we get a little bit of energy in the first part of our metabolism. If we add oxygen, we get a lot of energy, and we get heat and water and CO2, things that we can take care of beautifully. I mean, that's really the way it's supposed to go. Without oxygen, however, we build up acid. The body gets acidotic, and that's the correct answer here, is accumulation of acid. So ADP is not it, but if it sounds familiar, ATP is essentially a molecule of energy. The decrease in blood sugar, yeah, not so much. And development of hypoxia, well, if you're anaerobic, you're probably already there. The major complication is the accumulation of acid as we go through. And we can see that's the correct answer. All right. I think this will I wanted to put that pathophysiology question up there. I think that it was really good for us to do. And let's do question number 2. I'm still not seeing anybody in the question section here, and I know that you're out there. All right, here we go. Now we got it. All right, thank you. Oh, now look at the answers. I can see it. For some reason, it was going a little bit slowly there. We can see it. So now we're good. I can tell what's going on. So thank you very much. All right, here's question number 2. Really good clinical question. All right. 36-year-old male is playing basketball and now complains of a dull pain in the center of his chest. His breath sounds are clear bilaterally. His vital signs, blood pressure 138/82, pulse of 106 and irregular, and respirations are 16. You should. All right. Now, feel free to put your answer up here again in the questions, and I'll see what you guys are thinking. All right. And I've got a couple answers in here already. I'm enjoying this very much. Now, I'm going to have you guys read the questions next. See, me reading them to you, I don't want you to read into my voice. Before I go to the answer here, I want you to look at this question, and I want you to think about what is important in the stem of this question. The stem is the word part of the question, right? And here's what the National Registry does. You see this question? It's about 3 sentences. There's usually pretty much a full set of vital signs, and it ends in something like you should, you suspect, you should next. And these are often unlike the questions that you get in class because of 2 reasons. One is there's absolutely no fluff in the words in the stem of that question. And it asks you for a conclusion, not a fact. A class question might ask you, well, what type of pain is associated with, a cardiac, with a MI or acute coronary syndrome, and gives you choices. You're not going to get those in the register. They're going to ask for a conclusion. And that's why it's so important to read the question well. I had a student tell me that she actually covered the questions on the screen and read the choices on the screen and just read the question a couple times. The average length of time a student takes to answer a National Registry question is 31 seconds. Okay? Now think about that. And this was Todd Vreeland used to be the exam coordinator for the registry. Todd does questions for me, as does Bill Brown, who is the executive director. I try and bring in really good people to write questions here. I want you to really trust and depend on us. So he told me 31 seconds. Even if you on the EMT exam went to 120 questions, you could take a minute apiece per question. You might not think that's a lot, but I really want you to know when you're heading out for the National Registry later this month or maybe next month, don't wait too long. The longer you wait, the more you forget, okay? So, taking all that, let's go back to the question. What do you think is important here? I'm going to go through and say 36-year-old male, and he was active, dull pain in the center of his chest. Okay. Breath sounds are clear bilaterally, and there's his vital signs. So we went through that question. You could say, boy, everything's important. But let's look at the choices. All right? Ask if he takes nitroglycerin. This is actually one of the most chosen questions. But let's look at all the choices, all right? Because we got to find the best one. Administer oxygen by non-rebreather mask. Monitor his breath sounds for pneumothorax. Monitor his irregular pulse. What are the chances that a 36-year-old guy out playing a basketball match someplace has nitroglycerin, right? See, what the registry does, everyone says, oh, the registry is nothing like the street. The registry is nothing like class. It's all, you want to make the National Registry your enemy. But this is really the way you're going to think clinically, right? I don't think it's a particularly good chance that this 36-year-old guy's got nitro in his pocket. That's not the basketball crowd, right? And administer oxygen by non-rebreather mask. What I did, I'm very happy to see, is not a lot of people chose this. Now, I know there's people in classes that are told, give everybody oxygen, right? And that's old thinking. This guy, he's playing basketball, he's complaining of pain. It doesn't give us his oxygen saturation, but his blood pressure and his respiratory rate's good. He's probably okay. Even if he did get oxygen, it wouldn't be by non-rebreather. So I want you to definitely rule that one out. Monitor his breath sounds for pneumothorax. The question says his breath sounds are clear bilaterally. That means to me that, yeah, I could do that, but would that be the best thing to do? The registry will never trick you. I know a lot of you said, oh, it says they're clear now, but we have to listen to them, right? Because you probably said this is a young guy. He might not be having a heart attack, so maybe his lungs are the problem. Yeah, I get that. But if it says his lung sounds are clear, that makes this less likely. Finally, frequently monitor his irregular pulse. But of all the things in that question, right, what's going to cause a problem? 36-year-olds, really 76-year-olds in theory, short of atrial fib, and we try not to have people have that, they don't have irregular pulses. People's pulses are normally regular. This should stand out. So as you look at this, young guy, he's active, I'm going to say frequently monitor his irregular pulse. This is the thing that's most likely to make his heart stop or make him more critical when this happens. So, okay, Alan, you might not have got it right this time, but this is a learning experience. Remember I told you I want you guys to really think like the National Registry. If you're out in the street and you find this guy and you say, all right, what's important to do? I think that this is a valid question. It's more challenging than you had in class. But if you look at the question properly, everything you need to know to make the proper choice is there. Now, I will give you, these questions are challenging. All right, here's another one. I'm just going to check what people are saying here. All right, I just got to scan back through my questions. All right, we had a fair number of D's here. I get why you chose nitro. Boy, oxygen sounds really familiar. And, if your educator said everybody gets oxygen, I'd probably have to disagree with that because oxygen is not the number one choice anymore. And here's the other thing that happens. Let's say that you're finishing your EMT class, maybe you're in medic class, and you're going out on ride time, and you get a bunch of seasoned, men and women around the station, and they're saying, yeah, the National Registry, give everybody oxygen. That's not true anymore. The National Registry follows the Heart Association guidelines. Those guidelines say for saturation below 94%. And you know what? Even if you're at 91 or 90, putting a cannula on and having the patient close their mouth, take a couple deep breaths through the nose, they're going to be 96 before you turn around. So I think it's really important, to do that. So let me take a couple more of these questions here. There's a few things that I want to respond to specifically. All right, here's a comment. They always say treat the question basically, and a basic EMT would always give oxygen, and that's what gets everyone. Okay. Let me just say that, the registry has no hard and fast rules. Anybody that tells you there's any rules for the National Registry is not doing a favor. Some people say, oh, you always go back to the primary assessment, you always give oxygen, you always do things. I will say that oxygen is less likely to be the answer. Now, we're going to do an oxygen administration exercise. Since this came up and it seems to be a big thing, we'll do that next. But, EMTs don't always give oxygen. The old EMTB curriculum, I know sometimes people still say we're EMT basics and some states still call it that, but federally, you're an EMT. The EMT basic curriculum, here's the way it worked. You had a patient with horrible chest pains. What did you do? Gave him oxygen, brought him to the hospital. You had a patient in a really bad car crash. What did you do? Gave him oxygen, brought him to the hospital. You had a person with a slight limp and a giant ingrown toenail. What did you do? We gave him oxygen, we brought him to the hospital. That's what everybody did as an EMTB. Well, now the EMT is a thinking person, right? The EMT has a bigger toolbox. You've got naloxone and glucose and stroke scales. You need to figure out what's wrong with the altered mental status patient. You need to be able to make good clinical decisions, and that's why there are very few actual rules like that in the National Registry. The best approach is to look at the question and then read it really well, look at the choices, and then go back to the question and say, what does this question mean in relation to this choice, and to this choice, and to this choice? And you have the time to do it. All right, you guys are getting ahead of me. I wanted to address that question. You're welcome, Caitlin. I have a lot of fun doing these things. I got some people answering this already. You've had time to read this while I was rambling on here. An 8-year-old male ate peanuts at school by mistake. The principal tells you he's allergic and wants you to administer the medication. The child is cool and clammy, having wheezing and a swollen tongue. You should instruct the principal how to give the drug, assess him for hypotension, administer epinephrine, or contact the parents to treat. And this question is EMT level question. And in this, I want you to think about what's important here, what the question says. All right, if you look at this, it's a kid, and the kid appears to be allergic to peanuts, and the school has a medication on hand. The child is cool and clammy. All right, that says to me he's in shock. So assessing him for hypotension doesn't do a lot for you. That cool and clammy kind of tells you that, right? Wheezing and a swollen tongue tells you there's airway compromise or potential airway compromise. And if you don't act, there will be. So assessing for hypotension is out. And contacting the parents, the school may be in a position where they have the legal authority to give the medication. Certainly the mother left the EpiPen at the school for it to be given. Contacting the parents for consent to treat, even in the world of cell phones, may make a fatal delay. Instructing the principal on how to give it? No. Administer the epinephrine yourself. And Tony said the principal would be acting in the place of the parents. And I think that's good. I think in this case, if you'll read between the lines of the question, kid, peanuts, bad allergic reaction, it requires an urgent and definitive action. And we're going to give the epinephrine. All right, where's my mouse? There we go. And we're going to find that that's the correct answer. And we're going to move on to question number 4. 14-year-old female collapsed at a drugstore after receiving a flu shot. When you arrive, she's conscious and alert. Her vital signs are blood pressure 108 on 78, pulse is 64, respirations are 12, fatting at 97%. You suspect. Another one of those you suspect. Caitlin, congratulations on getting that right. These are hard questions. Now, when you look at this, read the question, maybe read it again before you look at the choices. And there are things in the question that you should be able to relatively easily rule out. And while you guys are putting the answers in, we'll make this like a game show where some of them get eliminated as you're choosing. Now, anaphylactoid reaction and allergic reaction. Anaphylactoid reaction is a serious allergic reaction, but it doesn't require prior sensitization. Sometimes we teach anaphylaxis, like you're sensitized to something, then the next time you get an allergic reaction. There's times you can have an allergic reaction the first time you're exposed to something. But since anaphylactoid and allergic reactions are both allergic reactions, is there any sign in that question that gives any indication that they're having an allergic reaction? There are no wheezes. There are no hives. There is no swollen tongue or throat. And the other thing that's really undertaught when it comes to allergic and anaphylactic reactions are gastrointestinal symptoms. When patients have just diarrhea or vomiting, that's actually a significant response to an allergic reaction, and that should be considered when you're evaluating the seriousness of it. But none of those things are there. As a matter of fact, I'll bet you that her vital signs are pretty darn close to normal for her age, right? Now, one of the things if you want to look at for shock, don't forget about the concept of pulse pressure. The pulse pressure is the difference between the systolic and the diastolic, and generally it's between 30 and 40 as a normal range. If it's more than 40, that's fine. If the pulse pressure becomes very narrowed, let's say that was 108 on 88. That might be concerning for shock, but that's okay. Her pulse is good, her respirations are good, her sats are good. This is one where you look at it, there's words in the question that mean a lot, all right? I'm just going to go over here and see what people are saying. All right, you guys are fun. Some people are picking 2 and 3. She fainted, right? Look at the words that words that mean a lot. Conscious and alert. If you see conscious and alert, don't pick things that are serious. It's probably not profound shock. It's not respiratory failure. It's not a critical thing. People that are conscious and alert and bright-eyed and have great vitals are in better shape. So that leaves us 2 choices, psychosomatic symptoms and vasovagal syncope. Now, what these 2 do, these require, and some people picked psychosomatic symptoms. The registry makes the questions choosable. Every one of these will make you say, well, even the allergic ones, well, she did get a flu shot, and you can have an allergic reaction to that. Don't jump to anything. Vasovagal syncope is the correct answer, C. Syncope means passing out. Vasovagal syncope basically is fainting. She went into the drugstore to get her flu shot, like a lot of us do. She saw the needle, she got the shot, she got woozy, her field of vision probably decreased because all her blood vessels dilated. Vasovagal, the blood vessels dilate. All of a sudden, there's not a lot of blood getting to the brain. She passes out. She gets to the floor. When she's on the floor, her head is the same level as her heart. The brain starts getting fed again. It gets oxygen and glucose like it needs. She wakes up and she's fine. It's like hitting a reset button on your computer, right? That's what happens. She passed out, and that's syncope. Definition of syncope is when you pass out. Generally, they call it loss of postural tone. You can't stand up anymore, and you end up falling down, and it goes away. Syncope resolves itself often within 30 seconds. She's suddenly better. Psychosomatic means that you believe you have a condition that you don't. So that's one that isn't there. Vasovagal. Vaso, meaning blood vessels, and the vagus nerve is the two parts of that. And what it basically does is, as a result of some type of fright or shock, sometimes it's if you're standing at attention for too long, your blood vessels dilate, and that makes it so blood can't get to the head. You pass out until you're on the ground and then you're level, and your brain gets blood again, and you wake up pretty quickly. And that's the concept of vasovagal syncope. It's vasovagal because it involves your blood vessels. All right, I've got one more question. We still have quite a bit to do here. Thanks for sticking with me. We got quite a group here. All right. I will admit that some of these, I hope I answered your question, Christina. And Paul, you're right. A lot of people read through the answers too quickly. In the emtreview.com site and the paramedicreview.com site, there's a section called Interactive Exam Review. And when you go into that, you take 5 questions, and there's some for each of the 5 parts of the National Registry. You take the 5 questions, and then you watch a video where I go over the questions. I'm actually there on the screen explaining, just like this, what you should see in the questions. Because remember, when I built that emtreview.com site, the paramedicreview.com site, I built it so you'd get knowledge, but also understand the National Registry questions. Many times people come to me, and they come to office hours like this. I do them every week. And they go through, and I say, look at the interactive exam review, and then get back to me and let me know. And they'll email me the next day, and they'll say, I didn't know you had to read the questions like that. And I say, yeah, you really do have to read the questions really, really well. All right, so we're starting to get some answers here on question 5. I gave you, while I was chatting there, a chance to read this. A 26-year-old male complains of increased breathing difficulty over the past 2 days. He tells you he's been coughing frequently. Vital signs are 124 on 88, pulse of 108, respiratory rate of 18. He's satting at 91% on room air. You suspect his saturation reading is low because he has. This could be, and some of these questions, like I said, I put in things here that apply to EMTs and paramedics. And largely, I picked these questions to show the kind of thinking that goes into the National Registry questions. These questions were written by Bill Brown, who was in charge of the registry. And I got to tell you, as an educator, I look at these questions as somewhere between amazing and evil. I mean, some of these questions are tough. And I will tell you, if you are getting these wrong, these are more challenging questions. What you do is you're learning from these. The ability to have gone through these questions, I believe, will make you look at a National Registry question differently when you get to the exam. So this 26-year-old guy has increased breathing difficulty. I think we did this. Coughing, vital signs, we went through, satting 91%. You suspect his saturation reading is low because he has. Now, in this question, there are some important things, and a lot of times it comes down to assessment concepts. Even though a lot of people say, well, EMTs don't diagnose, paramedics have to figure out what drugs to give and what to do. But EMTs really do have to at least come up with some idea of what protocol to do. So we do have some level of diagnosis. But many times in class, we don't get a chance to really think about assessment and history taking. We kind of do the sample history. Do you have any signs and symptoms? Do you have any allergies? Take any medications? Well, in this case, there are some nuggets if you think about this. One of the most significant diagnostic factors in this is the fact that it's been going on over 2 days. And the sudden versus gradual onset for a clinician at any level, from EMT through physician, as significant. And with coughing, that breathing difficulty, may say that it's some sort of infective process, right? And a lot of you are putting up on the screen now saying bacteria in the lungs, right? Letitia, I hope I answered your question just with that before. And Joseph, you're right. That 2-day duration does seem to be the key part of this. And Dee, let's talk about that inadequate tidal volume. His saturation reading is low because he has. What this question does, and I can write good exam questions, but I think some of these questions are amazing. Many collapsed alveoli in his lungs, bacteria in his lungs, inadequate tidal volume, or lower airway constriction. What he did when he made this question is he didn't put the name of the condition. He put a description of the condition, right? Let's start at the bottom. Lower airway constriction, right? What noise, thanks, Joseph. I'm glad. Lower airway constriction makes the airway do what noise? Often associated with asthma, when those small airways start to constrict, it's kind of like the balloon deflating when you pull the neck of the balloon and it makes that sound. The answer, there we go. We've got it. I don't care, Kylie, if you spell it wrong. I totally got it. Asthma would create wheezing. Nowhere in that question do you see any mention of wheezing. So I'm going to rule out lower airway constriction. Now, inadequate tidal volume. Letitia talked about inadequate tidal volume. The issue here is, what does inadequate tidal volume really mean? Inadequate tidal volume means respiratory failure. A patient is in respiratory failure when they have either an inadequate tidal volume or an inadequate rate. To have adequate breathing that's enough to support life, you have to have enough depth and you have to have a rate. So if you have inadequate tidal volume, meaning you're not getting enough air in each breath, that's respiratory failure. We have to ventilate him. And while he's got a SAT of 91%, otherwise his respiratory rate is 18, pulse is 108, his pressure's fine, and he's talking to you. He tells you he's been coughing. He's not in failure. Now it leaves us two. Bacteria in his lungs is an infection, and that's pneumonia. And that's what he's got, right? 2 days, difficulty breathing, coughing frequently. Bacteria in his lungs is pneumonia. Many collapsed alveoli. Well, in a young guy like that, it might mean a pneumothorax. In an older patient, it might be atelectasis, that whole section of airways that kind of fade off in chronic lung diseases and things. But there's no mention that he has inadequate breathing. And quite frankly, happening over a couple days, if it's a pneumo, that doesn't make sense. So this guy has got pneumonia, and that's caused by bacteria in his lungs. Remember, there's two ways to get a National Registry question correct. One is to know the answer. The other is to know that 3 of these aren't the answer, and that leaves 1, so that must be it. And I don't care how you do it as long as it's right. The registry doesn't care how you do it, as long as you click on the right one, right? What I hope that I was able to show you, let me go through and submit the answer. Bacteria in his lungs. When you do these questions, we give you a little report in the end. We just have a little 5-question quiz here. I think that what I hope to have shown you is that registry style questions are different than you've had in class. All the choices really seem like they could be correct, but one is going to stand out as the one that's correct. How do you pick that? You look at the question, just like I went through and did in these 5 questions, and pick out some of the facts. I think that that's really important. All right. Any questions on those? I see that you guys are, there we go, doing okay. Yeah, Paul, like I said, reading through the questions isn't good. I'm making sure I didn't miss anybody's questions. All right, I think we did good so far. Let's do some exercises. I'm going to move something here over to my screen. All right, This is called a dynamic learning exercise. I have a lot of these exercises. See if I can get all 4 of these on here. All right, so here's what I want you to do. I'll put them back up on the screen so you can see. Get my question set up here. All right, let me just see what Garner said here. When you break it down, it's so simple, but not really when we're actually taking the test. Yeah, I get you. There is a fine line between picking out the important facts and reading into it. It's a really good point, Garner. And when you're going there, I'm sitting here and I write an EMT textbook, and I've been teaching this for a long time, in 40 years. I'm obviously in a different spot, so I understand how you'd feel that interpreting the question versus reading into it is a challenge. The one thing that I will say is that to eliminate some of the stress is don't go in thinking you're going to get 100. While the registry doesn't acknowledge it, and myself and a large group of instructors find a group of students in classes that have sometimes some of the highest averages in the class going in and not being successful the first time on the national registry. And I think sometimes they get in and their heads explode somewhere during the exam and kind of freak out because it's not like class exams. And someone who's a 75 or an 80 or an 85 students, they pass, but someone who has a 96 average doesn't. And I think one of the reasons is that that reading in concept, that not going with the flow. Those people, interestingly, if they have to go back, will pass once they get their head wrapped around it. And that's hopefully what I've done for you guys here. But I get it, Garner. Trying to figure out what's reading into the question and what's interpreting enough is a challenge. Good practice questions are part of the key. I'd like to think that that my site, and I don't want to make this a blatant sales pitch, but EMTreview.com is designed to give you some of those questions, but with the tools to do it, and also a way to study. I'll show you that in a little bit. All right, I'm giving you 4 sets of vital signs here. All right. Oh, good, Gloria. Thank you. I'm glad that this is working out for you. So we have 4 possibilities: developing shock, head injury with increasing pressure on the brain, an uninjured patient who's nervous, like after a car crash, and then calms down, and then normal. So there's 4 sets of vital signs. Each one has 3 sets of vital signs within it, right? I want us to pick out what they are. All right. Shock, head injury, normal, and somebody who is nervous and calmed down. And let me tell you, you get somebody who crashes their car a good time and they get really freaked out and they're crying and upset. I mean, they have rapid pulses and rapid breathing, and you wonder if they're in shock. I mean, this is real stuff. So let's look at these. First one, and feel free to type some stuff in here. Uninjured patient nervous. Well, we have the pulse going down. We have the respiratory rate going down. Even seems like we have some stabilization in the blood pressure. Kind of when we get worked up, sometimes our blood pressure does go up a little bit. That's come down. And then the pupils are good, and the skin stays the same. So I actually said that. Garner, you're getting a gold star here. Nervous after a car crash. You guys are getting it good. All right, and we got some people jumping ahead. I totally get that. All right. Tristan is flying through these, and he's doing right. He's getting them right. The second one is normal. You may have as much as 8 or 12 beats a minute variation sometimes, just normally. When you show up, even though we might be the knights in shining armor, just our presence in the ambulance outside makes people's pulse go up, right? But everything here seems relatively consistent, right? We're not seeing big changes here. And don't forget the skin, I think, is really, really important. So number 2 is normal. And this is the opposite of shock. Remember that the pulse goes down and the blood pressure goes down. And it's important. There's a reason we're doing all these vital signs. Number 3, the pulse goes up, respirations go up, the blood pressure not only starts to go down, but we're tightening up, getting a narrowed pulse pressure here. But look at this. the skin goes from warm and dry to cool and dry to cool and moist. That means that number 3 is shock. Oh, look at this. All right, and we're going to number 4. Chase and Paul and Elizabeth are getting this. And number 4 is the one that's left. It's increasing intracranial pressure. Remember, not every head injury shows that way. When blood starts to build in the brain, it squishes the brain and it pushes it down. It pushes the top of the brain down to the brain stem, and if it really starts to herniate, it pushes the brain stem out through the bottom of the brain. It's a horrible thing when you see that. But there's a pattern that you'll see in vital signs. The pulse goes down and the blood pressure goes up with a widening pulse pressure. And here you can see the pupils became sluggish as this starts to get bad here. And the skin might be a little variable. Respirations get a little funky. People talk about Cheyne-Stokes and central neurogenic hyperventilation and different types of breathing. And remember that Cushing's triad, which talks about the vital signs in head injury, says the pulse goes down, the blood pressure goes up, and I'm very happy saying the respirations get funky. They're going to be probably irregular depending on how much the brain is being squished. And remember that head injuries can do this. There are some populations where it's more likely to happen. Patients taking Coumadin or other blood thinners because of atrial fib. Alcoholic patients actually have some shrinking of the brain, and the dural bridging veins sometimes rupture, causing internal bleeding. And then, just head injuries in general can do that. The elderly population, too, can find it a little bit easier to get that. So, really, head injury and shock are opposite. Pulse goes down, the blood pressure rises in head injury. Now, look above at shock, right? The pulse goes up, the blood pressure goes down, the respirations here also get up, but the skin is an important factor here. I once had a kid who was a passenger in a car, and she was smashed right into her door, and she was lying on the ground. The driver was standing up. Don't forget simple things. If you pull up to a call, somebody's lying on the cold pavement and somebody's standing up. Who's sicker? Probably the person lying on the ground. So we split up, and I found her, and her pulse was rapid, and her breathing was rapid. And I said, all right, let's get going here. Let's get her, to the ambulance, and we'll get going. And I was trying to figure out their injuries. My exam didn't show anything, but I couldn't get her pulse and respirations to come down. So we went to the trauma center. We got to the trauma center. As paramedic, we started IVs. We did stuff. Nothing was wrong with her. She left before I finished the paperwork. But her vital signs matched what looked like shock to me. So you have to do that. Clayton put a question up here. Why do the eyes go sluggish? The eyes, the optic nerves and the things that move our eyes start to get squished. Now, it really depends on where the bleeding happens in the brain, but the pupils can be sluggish. And as they go on, they may become unequal. And that's one of the other things that you'll see. By the time the pupils become unequal and you get funky respirations and things, the patient's going to be in pretty bad shape to begin with. But basically, the reason that happens is because of the cranial nerves that control the eyes. When that part of the brain becomes affected, it changes the ability of the eye to respond to light, and then it may change the size of the pupils, even though that may be a little late and depend on where the head injury is. All right, Clayton, I hope that one helped you. I'm going to do one more exercise here. What I'd like you guys to do, we've got about, holy cow, only 15 minutes left. I hope you're having fun. I'm enjoying this. I wish I had these crowds every week. Every week I do a live session like this. If you subscribe to our EMT review or paramedicreview.com, you can come to these, ask questions. It's pretty much like this. I go over test questions and I do some exercises, physical exercises like this one here. All right, I'm just going to enlarge this a little bit. This, I think oxygen administration is something that we really kind of struggle with. I think it's important. For each of the following patients, determine whether you'd give oxygen or not. If you choose to give oxygen, choose an appropriate delivery device and flow rate. All patients in these scenarios are breathing adequately. They're not in failure. So we're not going to do a BVM. We have basically three choices. We have no oxygen, nasal cannula, or non-rebreather. And I will admit that there's still a lot of educators who are telling students, if in doubt, give oxygen. And some of the old timers probably tell you to do that too. And I think that that we have to be careful. This is over at 9 o'clock. They're generally about an hour, so we have about 15 more minutes. Kylie. All right, 19-year-old male patient broke his arm in a lacrosse game. He's in pain, but he's conscious and alert. All right, Aaron says no oxygen. Caitlin says none. Christina, Letitia, Joseph. I agree, no oxygen for this guy. In the old days, we would have, but really, he's probably not hypoxic. 74-year-old female patient appears to have fallen and broken her hip. She is slightly confused. Her oxygen saturation is 95%. Let's see what I've got going on here. Let's see. I've got a lot of none. I've got a couple nasal cannulas. And you know what? I'm okay with none, and I'm okay with a nasal cannula. Now, I put these up here because I wanted to talk about things. She might be confused normally. She might be confused because she's a little cold because she's been laying on the floor and broken her hip. We also know that the oxygen saturation might not always be the most reliable in seniors because of their circulation, although if it says it's 95, it probably is. I want to make sure she didn't, have a stroke or something else that made her fall, but for the most part, I think I'm okay if you said no oxygen because 95%. I think that would be okay. And if you did say I'm going to give a little by cannula and see if it helps her confusion to rule out it being hypoxia, I don't think you're wrong with that either. So, Richard. Hi, Richard. I think that's okay if we did want to give a little oxygen there, but I think that we don't always have to agree 100%. 2-year-old patient, respiratory distress. They called the pediatrician, thinks it might be RSV, a virus. Child has suprasternal retractions, but responds to her parents. The pulse ox says 87%. But, with kids, sometimes you tape one over their finger when they're little, the regular pulse ox isn't going to work. 87%. Suprasternal retractions. Okay, good question, Christina. The National Registry is going to probably put in some words you don't know. They don't like to use big words for the sake of big words, but they will use clinical terms. So retractions are in the chest when you see the skin getting sucked in. That's the easiest way to put it. So if someone's having real difficult breathing, when they are trying to breathe and trying to pull the air in, sometimes the skin between the ribs actually sucks in. And those are intercostal retractions. The costal cartilage in the ribs is where that's from. Suprasternal means above the sternum. So if you follow the top of your sternum up to where you check for tracheal deviation, that's suprasternal notch, and that's getting sucked in. In kids, you'll see retractions, that skin getting sucked in over the clavicles in the front, the collarbones, and over the suprasternal notch. You'll see that. To me, this kid is having trouble breathing. I'd give him non-rebreather if he'll tolerate it, if she'll tolerate it. If not, we could try blow-by or something else, but I'd give this kid oxygen. I think that's totally fair game. 74-year-old woman's found by her daughter, slurred speech and facial asymmetry. All right, we're thinking there is a stroke. And we're going through. Slurred speech, facial asymmetry follows instructions. It looks to me like we're largely thinking no oxygen, and I think that's correct. Oxygen may actually be harmful. If they're able to revascularize that area of the brain, oxygen and the bad stuff that's built up there with that hypoxia isn't going to be good. This woman with a stroke, reading at 98%, no oxygen. 30-year-old male patient, unresponsive after being ejected from a vehicle. I'm good with oxygen here. And I remember, I didn't give you an entire scenario and vital signs. Some I gave you a pulse ox reading, some I didn't, because the American Heart Association says, less than 94%, but they also talk about or signs of hypoxia. You know what I mean? The oxygen saturation reading and the perceived level of hypoxia by the patient, the way they feel as far as their breathing goes, doesn't always match. And if a patient really has severe distress, we have to make a clinical decision. In this case, a trauma patient, a young patient, unresponsive after being ejected from a vehicle, if he doesn't require ventilation, I'd put a non-rebreather on that guy just because. 64-year-old male patient complains of substernal chest pain. He's setting at 93%. All right, that's below 94%. I think a nasal cannula with a couple liters is probably good for him. We're getting some big response there. I got to actually try and catch up. You guys are ahead of me. So yeah, the 64-year-old guy, chest pain, saturation below 94, a couple liters per cannula I think is totally good. High school football player, concussion after a hard hit. He's confused, but he's setting at 99%. I think the confusion can probably be related to the concussion. And I would say that in this case, he probably would not get oxygen either. Football player, no O2. Gloria and Chase and John all got that one correct. All right, so this is what a office hours looks like if you subscribe to emtreview.com or paramedicreview.com. On that site, we have the interactive exam review where you take 5 questions and then you listen to me. Hopefully it's not too painful. Go over those questions. I think that's the most helpful thing on there. Diagnostic exams based on the registry sections. Take 40 questions, see where you stand. Sample registry tests. There are videos to watch. There are study guides that give you stuff to study. And then the other thing that we do is we have a study plan, actually a 5-week study plan that you actually can look at. Now, I'm gonna throw that up in the handouts down here. I'm going to give you a couple other things as well. I'm just going to go over the other side of my screen here, and I want to give you a few things. For some reason it closed down on my computer, but I'm going to, in the chat section of this, the lower right hand side, there's a chat. The first thing I'm going to put in here is I have a page which has some sample audios. Limmer Creative also does audios. We have for EMT, we have 33 audios. AEMT, we have 8. We'll be working on paramedic for the medic students out there. I don't have those yet. Medic is so big, it's challenging to do. There is a shock lecture on there, and there's asthma for free. So our $19.99 a month subscription contains all the stuff I talked about. We also, you can have an add-on $20 and you get $35 worth of audios. You'll get an email after you've been here tonight or tomorrow, which will give you a code for a discount on that. And I think that that might be something that you want to look into. Sometimes people don't look at their books and find it real easy to study, and having some study plans or some audios are good. Sometimes you have a long drive, and I think that can be beneficial. Now I'm going to give you here. I'm also going to put a handout here where I'm going to do. Where's my desktop? And I'm going to do. Let me go over here. I've also included in the handout section on the page one of our 5-week study plans. What we do is, I've worked with a lot of people over the years, and I've found that people don't always know what to study. You leave class and say, okay, I'm going to study for the registry. And you go back to your book. I write an EMT book. I want you to look at the book. But if you've been through the book in class, that's not what you need to study. You need to go through and do things that are going to make you think, have some good practice questions. So I think that because of that, I created this 5-week study plan. It's a 5-week plan, and 1 week is for each part of the National Registry. So, for example, let me bring this over into my screen here. Here's the 5-week study plan, week number 4, cardiology and resuscitation. And then the plan, here's what to do in the book. Here's what to listen to if you have the audios. We have diagnostic exams in the MT review. And then we give you worksheets. You know, cardiology and resuscitation is 20 to 24% of the National Registry. And in a lot of books, that's really only one chapter, but up to a quarter of the National Registry is on that. It's really important to study. Remember, what does the registry ask you? You should next, you suspect. So this exercise as part of the 5-week study plan says, choose the most important of the 2 choices. You arrive on scene, determine a patient's pulse list. Do you compress or defibrillate? You complete a primary assessment, alert patient with chest tightness. Do you give oxygen or aspirin? You've defibrillated with your AED. Do you check the pulse or start compressions? These are the kind of things the registry is going to ask you in a long question. You're performing CPR and observe the patient exhibiting gasping respirations. Do you check the pulse or check the blood pressure? So, and then we also give you a worksheet to make sure you know all your CPR stuff tight. And there's 5 weeks of study plans in here. I have actually, if you look at the right-hand side of your screen, you have the 5-week study plan there. In the chat section, you have a link to some free audios, and those audios can be part of your emtreview.com membership. Now let me come over to this. Letitia, thank you for coming by. And I got Christina answering some of these questions. So I'm not going to go through and answer these. I want you to look these up. I hope that you download these. I hope that you take it. I think that they are. I think that they're valuable, and I've designed them to give you what you need. Kylie and Clayton and Paul, thank you very much. Matt asked if they're every Wednesday. I actually alternate the dates and times. Sometimes I do them during the day. Sometimes I do them at night, and I do them different days and different nights of the week, just to kind of vary the time a little bit. And in these sessions, we would go over these 5-week study plans. Wherever people happen to be, we'll go over and answer questions and do those as part of it. D, on the National Registry, all the questions are multiple choice. Richard, the 64-year-old male, I believe we've gone past that, had a 93% saturation reading, and I think a cannula would be okay. Christina, you use a non-rebreather. I'm just going through some of the questions here. Christina asked, can you remind me when you use a non-rebreather? The non-rebreather is really kind of reserved for the most serious patients that don't require ventilation with a BVM. Patients with very low oxygen saturations, and I think also patients that have lower oxygen saturations, but also have really poor skin color and look really bad. Patients that have cyanosis. If the patient or if a National Registry question says they look blue around their lips or their nail beds, that's a sign of some pretty bad hypoxia. And I think that's a good time for a non-rebreather. Will this webinar be up for anyone that missed it? Michael asked that. Michael, you will get, I'm taping this, recording the whole thing. You'll see the screen and hear my voice. You will get this so you can watch it again if you choose to. Anyone that's registered will also get an email with the information on the site being available. And I certainly don't mind if you forward that to somebody else, Michael. I hope that we're doing that. Antonio says, what would be a good average time to spend on studying for the National Registry? Boy, I don't know you, Antonio, and what's going on, but it certainly is a good question. Everybody wonders, how much. I think it varies from person to person. The variables would be how well you did in class, how you appear to, you feel that you know the material, right? If you did some practice tests, a lot of people read the book, or other people say, well, I took a bunch of practice tests. Studying is not a passive thing. It's got to be active. When you take practice tests, keep a pad or a post-it or something next to you. Any word you don't know or any question you get wrong, write down a word in there you didn't know. Write down the concept. That's the stuff you go back to the book and study for. So I think there are a couple things I will say about studying, though, Antonio, is that studying is generally done in small bites. Some people say, well, I'm taking the registry next week and I've got 3 8-hour days to study. Study for an hour and then take a walk or, do something, go call a friend, check out social media for half an hour and then come back and study again. I'm not advocating social media studying, just for the record. But we find that studying in small bursts actually has better results than long marathon study sessions. So I think that I would say to do that. I would also say don't delay too long taking the National Registry. The number of people that I talk to that say, well, it's been 6 months, and I really haven't gotten around to it. Listen, a lot of times your instructor has beat you over the head and said, the registry is really, really hard. You don't study in class, you're going to fail. So you think you're going to fail, right? And you think, oh, maybe I'm not going to go, or oh, you put it off. Don't put it off. You know what I mean? Let's say you finish your class now. It's December. It's 9:01. I'm going to go a little bit long. If you guys are still here, stick with me. I'll just go a little bit long. You get out now, you're saying, well, maybe it's the holidays. Plan on taking it, sometime the third week of January. Study a little bit before the holidays. Enjoy the holidays. Take some practice tests, when you're trying to get away from your family and the same eggnog stories that they always have every year, right? Study a little bit then, and then hit it again regularly for the first part of January and get in there. If you wait until March, April, May, June, you're going to start forgetting stuff. I can't tell you how long to study because I don't know how well you did in class. I would certainly say I take it seriously, and those would be my study guidelines. These study sessions are part of the service you get, and the website is called emtreview.com. EMTreview is one word.com. It's also paramedicreview.com, and there's specific information for both. Paramedics, you get the EMT stuff, too. You will get that on the National Registry. And I do these exams every week. I generally alternate between noon some days, and then I do 8 p.m. Other days. And if I have big groups, I'll do more than one a week. But these are part of that subscription to emtreview.com. Question from Joseph. What areas on the exam gives people the most trouble? Ooh, that's a good question, Joseph. I think that cardiology and resuscitation is a problem because there's so much of it. And quite frankly, your CPR card and going over the lecture for cardiology in class isn't enough. They'll give you questions. What happens if you're running a code and this happens? They'll actually get procedurally in there. So I think cardiology and resuscitation is one of the challenges. And I think the other one is medical emergencies and OB. That's only because there's so much material in there. And OB is one of those things where that's like one chapter, but there's a lot of stuff in there, from placenta previa and placental abruption and limb presentation and all those things. That OB stuff can be kind of tough. So I think cardiology resuscitation is one, and medical and OB is another. Christina, these are an hour. Sometimes we go a little bit long, but there's only so much attention span. Certainly I have. I'm an EMS person at heart, and to do this. But like I said, we can do more than one a week if we end up getting, sometimes we get a ton of subscribers. Aaron asked a good question. In the book, it says suction for 10 seconds, but a test I took said infants 5 seconds. That's a really good question. There used to be 15 seconds for an adult and less for kids. Kids don't have a lot of airway space, so suctioning can make them hypoxic. That suction can also make them bradycardic, have a very slow heart rate, and that's one of the reasons they say suction kids less. But here's the thing about suction, and we taught this wrong for years, Aaron, and there really is no time limit, because here's the thing. Let's just say you get to a scene and there's a guy that just finished dinner. and someone's doing CPR and the guy starts to vomit, right? And he just had Dinty Moore beef stew, and you're got your gloved hand, and you're sweeping potatoes out of his mouth and pieces of carrots and all this other delicious stuff. And he keeps vomiting. And if someone said, "Oh, 15 seconds is up," if you ventilated, you'd push food into his lungs, and that's fatal too. So the concept of suctioning, I've changed in my book to say suction quickly and efficiently with whatever you have to do. Sweeping with a gloved hand, use the suction tubing. Of course, we can tilt them on their side, and then when you get it out, then begin to ventilate. Because it's not as clear cut. It's just having a straight time frame. And I would be surprised if the registry asked a question like that. I think they might say a patient's vomiting and they vomit for 20 seconds. What do you do? And what's the answer? You keep suctioning. You can't just blow that junk into their lungs. I mean, that'll kill them later in the hospital. So the reason they say kids are less is because kids have less airway space, and they also can get bradycardic and get really sick from suctioning. That's why kids are different. Brady, no more than 10 seconds. If I have that in there for kids, I'm not sure. Jones and Bartlett gives time, 5, 10, and 15. I don't think times are right. You know where those times came from, that 15 seconds? It's when people were in the hospital, they were intubated. And doctors and nurses came out in the 70s and taught EMT classes, and we stuck with it, right? How about pre-oxygenating patients before you suction? Well, you have to be a psychic. Oh, they're going to vomit in 2 minutes. I better give them some extra oxygen. It's junk. We can't do that. We try and get modern and grow in EMS. And the fact is my answer as a textbook author is, and with our medical editor and everything else, is suction quickly and efficiently, get it out as best you can, and then get back to ventilations or compressions, whatever you have to do. I think that's really the best answer. The next session, that's a good question here. Hang on, let me see. The next session will be, if you're a member of emtreview.com, I have one Thursday, December 13th at noon, and I have one Sunday, December 16th at 8 p.m. We pick it up again after the holidays on December 27th. So sometimes I'm doing a Sunday night, I'm doing a Thursday afternoon, and then a Thursday evening. So we vary them to try and get people to come. But we always do at least one a week. And like I said, there's a lot of demand. I'll do more than that. Let me go through and make sure I've got all these questions here. So I gave you the time for the study sessions. A lot of people saying thanks, and I really thank you for coming. There's a lot of people. It's 9:08, and I'm watching people start to fade out of here. So I think I'm going to call it a night. Again, you'll be getting an email, and we'll have a discount code for EMT and paramedicreview.com. You'll have a link to get the video from this. You can use it again if you have the urge to listen to me more. You can send it to your friends. And I had some great questions, some amazing participation. I am really happy that you're all here and that you enjoyed this. I really love to teach, and I'm glad I was able to share this with you. I'm Dan Limmer from Limmer Creative, limmercreative.com. We'll get you to anything that we do, as well as giving you a chance to drop us an email if you need to. I wish you all incredibly well on the National Registry exam, and I hope that I see you online in future office hours. You all take good care, stay safe, do well on the test.